Okay, Dr. D. Webster again in my ongoing video series about the travesty of lack of access to PET-CT in Ontario for cancer patients, but also other patients like dementia, cardiac, and otherwise. And the last couple of videos, I've been giving the details of my interactions with 3 previous ombudsmen, but we're now dealing with the patient's first ombudsman, Ms. Ms Elliott. And I had made the statement at the end of the last video was Ms. Elliott will take the efforts of the Ombudsman's office to help the agenda directed at patients to an entirely new level. So this video is entitled My Interactions with Ms. Elliott and Her Ruling on What Happened to Caro. Now, you need to understand that her mandate, Ms. Elliott's mandate as the patient's ombudsman, watchdog, whatever, her mandate is outlined by a Liberal Act from 2010 defined as the Excellent Care for All Act of 2010. You can decide for yourselves at the end of this video. Now, this is the chronology of my interactions. I tried to contact her office in February 2017 to try and meet with her. I was finally allowed to meet with her and her lawyer in April 2017, and at first I was very hopeful, as was Caro. So immediately I sent an enormous number of documents, and by May, Ms. Elliott and her lawyers had access to all the last 15 years or so of documents I have on what's happened with PET in Ontario, as well as the details in excuse me, got a bit of a cold here, as well as immense detail on these 3 patients. I've really only discussed Caro, talked about some of the other patients in other videos, and this was their relationships with Cancer Care Ontario, which is what led to these complaints to the patient ombudsman. Over that course of the next 8 months, I will deal with 3 different lawyers from her office. Now, also, finally, I'd keep calling and getting emails, and everybody, they keep saying, it's getting towards the end of the summer, oh, don't worry, we'll get back to you as soon as we can, shortly, it's checks in the mail kind of a thing. But I did emphasize, look, Caro is very ill, and I said, is very likely going to die within a month or so, and she really would like to know what Ms. Elliott's ruling will be before she dies. I mean, Caro had always held out hope that her unnecessary suffering will not have been in vain, that in fact Ontario physicians will no longer be forced to do to patients what we, including me, were forced to do to her. And Caro represents an archetypical case example, which I assure you happens on a daily basis if you have cancer and living in Ontario. So my last communication is in September with Ms. Chris Mondazine. I think I've spelled that slightly wrong, it doesn't really matter. And he states that Ms. Elliott, she was off sick first part of the summer, not well or something, I don't know what it was, she wasn't available to reply, and he would get back to me as soon as possible. Well, Caro dies in the hospice now in October of 2017, tragically. Now, so in November, I write Ms. Elliott, and this is exactly how it took place. I was now crafting a response, and I received an email from Caro's best friend and colleague, and she informed me that Caro had just passed away in a hospice early on. When I was seeing Caro, as you know, she gave me permission to use her name publicly, and when I last saw Caro a few weeks ago, she had desperately hoped to be able to get back home, as she had been in the hospital now for, 4 months, and she really just wanted to spend a few days at home in the comfort of her own bed with her family. That never took place, but it could have, had she have had a staging PET-CT. Now, I also said, as I had not heard anything from your office, I was going to ask if you finally had anything to say to Caro. She has always held out the hope about her suffering wouldn't be in vain, and so on. Now, just to make clear that Ms. Elliott was fully aware of what happened to Caro, because I did send her those videos on her. There's actually 3, one's a shorter one, but whether she looked at them or not, I don't know, we'll never know, maybe she just doesn't care. But I concluded I would ask that you take a good look at the videos on Caro and what she and, of course, her family suffered through, and, of course, her family continues to suffer through. Then I would respectfully request that you make a statement that I can pass on to her grieving family, or if you prefer, to send it to them directly. And I conclude with, based on my dealings with you and your representatives, I see no further need to have any further contact with you or your office, at least until I can assess what you have to say to Caro's family. So there's a teleconference set up in November 15th based on that letter, and it's Mr. Chris Mondazine again, and a new lawyer, Ms. Genevieve Curry. Now, she was the one that handled the entire, I don't think Mr. Mondazine said a single word during the actual discussion, but it becomes within minutes immediately obvious they are going to dismiss absolutely everything that happened to Caro. Now, initially I tried in vain to argue the points, but it was clear that Ms. Elliott would follow in the footsteps of her, previous 3 ombudsman / watchdogs that I had dealt with. And even though this is what Caro and I had expected from the very beginning, we really kind of had said, well, the sun will likely, rise in the west first before Ms. Elliott will actually tackle this. But Anyway, we said, she's a conservative, maybe she'd be willing to take on the Liberals. But it was still very disturbing, to say the least. We talked about that before she died, and now, of course, her family and loved ones. So this is what happened. This is part of the ruling. I could have more to say on it later, and I will put it up on my website, the full ruling. But first, she rules that, there were aspects of Carol's care that represent a good example of excellent care for all in Ontario. But then secondly, what she really is saying is that, well, actually none of pretty much what happened to Carol, these other patients, is anything to do with her mandate. So it's of absolutely no concern to Ms. Elliott. So this is, so why was Carol's case and other patients not part of her mandate for excellent care for all? This is a quote from that letter about the Excellent Care Act for All Act in 2010. The legislation provides that she can receive complaints from patients, former patients, or caregivers, which was me in this case, about actions or inactions of a health sector organization, read Cancer Care Ontario, that relate to the care and healthcare experience of a patient or former patient. Health sector organizations are defined as an act in the Act as a publicly funded hospital, the very first one in that list. Now, let me just emphasize that. A publicly funded hospital. Now, I can assure you that 100% of all of these patients, but in particular of Carol's care, from the very first visit to our oncologist, and every blood test, every investigation, CT-MR, ultrasounds, or PET-CT, and ultimately the contraindicated radical therapy to her pelvis, which mutilated and created such misery for her, along with all of her follow-up visits, and then finally her hospitalization until she dies, took place within a publicly funded hospital in Ontario. Think about that. So then I send a response, and I'll put that up later as well. It's a more detailed letter, of course, but one of the first questions I asked, of course, made sense, and they wanted to know, what do you mean that they do not lie within the section of the mandate? And I go on to point out the actions that take place in a public hospital. So this letter was sent, registered letter, or at least by letter, it was sent January the 9th, 2018, and today is March the 9th. There is still no response yet from Ms. Elliott, even though I've been in communication with her office since then and been told, don't worry, there'll be a response. So here's a partial summary, of what Ms. Elliott is aware of about government assessment of PET-CT for Ontario's patients. Above all, Ms. Elliott is fully aware of and the specific reasons why Carol would not have undergone her contraindicated mutilating radical radiation therapy to her pelvis if she had had a PET-CT for staging in Ontario, which she was not allowed. Now, and although this has been an accepted world standard of care for many years, and as an example, I was at my 40th reunion in medicine in October. I talked to a gynecologist friend, who's worked in the States his whole career, and he was dumbfounded. He said, listen, we've been using, PET-CT, I don't know, for the last 20 years as the standard of investigations, for these patients. The oncologists won't even see them without it. So that's not in Ontario, of course. So this is the partial summary as well, what she knows. To continue, she is also fully aware that as Ontario physicians, we must follow the CCO, quotes, standards of care that forces us to practice what could be considered incompetent or worse medicine on our patients. And again, look at the video on Caro, and this is exactly what led to my being accused or threatened by Cancer Care Ontario in the college, and this happens on a daily basis in Ontario. But what's happened, she's also aware, of course, is that because of my efforts to advocate for this patient and prevent what happened to her with the PET-CT, that my license to practice medicine in Ontario is being threatened by none other than the senior executives and chairman of the Board of Cancer Care Ontario, and, sadly, the College of Physicians and Surgeons of Ontario. So she's also aware of the CAM motions from 2005 declaring the CCO trials, among other things, as being blatantly unethical, and I have videos outlining why they were unethical. And you need to know, however, that one of the patients that Ms. Elliott was asking to be considered was a 30-year-old, tragically, case of a 30-year-old woman just gets married and has locally advanced breast cancer. And she represents the exact patient that the entire rest of the world knows needs a PET-CT scan. Now, Ms. Elliott then is also fully aware of all aspects of why it was the CCO PET trial on women with breast cancer that led to those CNM motions in 2005 as being flagrantly unethical. And they are, and these experiments continue to this day on patients. Now, therefore, Ms. Elliott is fully aware of and therefore supports the use of this, quotes, and these are words coming from me, these are words out of documents, this unethical, bordering on immoral trial to continue to block this woman with breast cancer from access to a critical PET-CT because he has the misfortune of living in the Ontario Liberals' evidence-based Patients First healthcare system. So she's also fully aware of the previous ombudsman and that their response to my colleagues and the complaints we put were an insult to us. I mean, they were saying, "Oh, we didn't understand. We were confused. We were talking about policies, and they were talking about process." Of course, there weren't any policies in place before 2009, long after these trials had been put in place. So it was obvious they were, and they won't get back to us to defend those, of course. Now, also that. How could, how CCO McMaster, experts from the Evidence-Based School of Medicine, no one's even trying to pretend from there that there's any science whatsoever in the way that they assess whether or not patients like Caro would get access to a PET-CT. And to quote Professor Rodney Hicks, a world-acknowledged PET expert who's from Australia, who said to me in an email a year ago, David, Ontario has the most egregious and politically motivated agenda against PET, and of course, read our patients, in the world. Now, for Ms Elliott, none of this is of the slightest concern for Ms Elliott, Ontario's first patient ombudsman. Now, what I had said previously was what Ms Elliott has done as an ombudsman has really set herself above and beyond the other ombudsman. And why would I say that? Because the previous ombudsman were just dealing with these technical nonsense issues about process versus policy and so on. Ms Elliott is fully aware of all the technical aspects and the medical aspects, which I personally explained to her in great detail. In other words, she is now dealing with the direct consequences to patients from the process of the Ontario government and their direction, what they're doing in this agenda directed at patients. And again, this happens on a daily basis in Ontario, and is why I have said, if you get cancer, you should consider leaving Ontario. So, what do you think about Ms Elliott's role in the travesty of PET-CT in Ontario is? So I've asked the question before, are ombudsmen acting as watchdogs, as they will tell you, or simply lapdogs for our government? Or worse, in Ms Elliott's case. Does Ms Elliott represent the level of contempt that the Conservatives may also have against cancer patients if they gain power in the next election? So, do we want this person to be the next Premier of Ontario? I would suggest that it's up to those of us who really care about patient care in Ontario to make sure this person does not win the PC nomination for the leadership of the PC Party of Ontario. So you can try contacting her and flooding her with emails. There's the Twitter feed and so on. Now, my next video in this series will be, again, some case examples to drive home the points of what happens to patients on a daily basis. And then I'm going to follow up with a very important one for men with prostate cancer in Ontario. And I can tell you, you need to be very, very worried. Why? Because there is an absolute revolution in how PET is being used to diagnose, follow up metastasis, and involved with therapy and therapy responses around the world, with the exception of how it's going to be considered in Ontario. So I want you to remember the special efforts of the Liberals and Cancer Ontario and their colleagues at McMaster University Evidence School of Medicine to cancer patients who had breast cancer. Men with prostate cancer will be in the government sites and the next group for special attention from their medical experts. Thank you. So hopefully this is of interest to you, and please pass it on to as many as you can and do whatever you can to make sure that Ms Elliott does not become the next Premier of Ontario. Thanks for your support, and please watch my further videos, like, and do whatever you need to do on social media to make this work for us all, and especially for the patients. Thank you.